I now have the honor to invite His Excellency Terrance Drew, the Prime Minister and Minister of Finance, National Security and Immigration, Health and Social Security of St. Kitts and Nevis. Your Excellency.
Thank you. Chair, Excellencies, distinguished colleagues and partners in global health, I deliver this statement on behalf of the Caribbean community, where, as head with responsibility for health in the quasi-cabinet, I am delighted to deliver this message. The Caribbean community has long recognized that health is the cornerstone of sustainable development, economic resilience, and social cohesion. Since Port of Spain Declaration of 2007, our member states have taken bold steps to confront the rising burden of non-communicable diseases and to advance mental health as a central priority. These challenges are not merely clinical. They touch every aspect of our societies, from our economies to our families, from productivity to social well-being. Over the past 18 years, we have made measurable progress. Member states have developed individual NCD plans and strategies strengthened primarily through our primary health care systems and expand, in some instances, integrated mental health services. Permit me to highlight one of CARICOM's achievements during my tenure. In response to rising rates of crime, heads of government held 2 regional summits, which led to the development of a consolidated framework for addressing crime and violence from a public health issue, as a public health issue. We are acutely aware of the interlinkages between crime and health and their implications for socio-economic instability or stability of small island and low-lying coastal developing states. As a medical professional, I have a great passion for and remain deeply committed to using evidence-based solutions, which has enabled me to support the implementation of survey findings from St. Kitts and Nevis to inform new strategies. We have enacted policies to create healthier food environments and regulate harmful substances. We have also developed school and nutrition policies in some member states and look forward to adopting them in other member states. Fiscal measures such as taxes on sugar-sweetened beverages and tobacco, reflecting our understanding that strategic economic instruments are critical tools in reducing risk factors. We have advanced cancer prevention initiatives, and through our leading public health agency, CARICOM, have been able to strengthen surveillance systems to guide evidence-based interventions. These achievements demonstrate the determination, innovation, and political will of Caribbean governments and health leaders. Regional cooperation has been central to this success. Through CARICOM, member states have harmonized policies, shared best practices, and coordinated multi-sectorial responses that no single country could achieve alone. The Bridgetown Declaration reinforced this commitment, emphasizing that health must be integrated into social, economic, and environmental policy, highlighting the importance of equity, rights, and climate resilience in building strong health systems. We also acknowledge with gratitude the indispensable contributions of our regional institutions and partners, CARICOM and PAHO, and civil society advocates such as Health Caribbean Coalition, and who have championed people-centered policies, strengthened accountability, and amplified the voices of our communities and our health professionals who work tirelessly to implement the policies and programs. We have endorsed and adopted the Caribbean Moves initiatives and continue to raise awareness of NCDs through the observance of Caribbean Wellness Day, World Cancer Day, and World Health Day. It is important to note that we do this in collaboration with our communities, civil society organizations, faith-based organizations, and other institutions to ensure a whole-of-society approach. Yet, despite these advances, the challenges is far from over. For CARICOM and SIDS, non-communicable diseases are not just a health challenge. They are an existential threat. They account for most deaths in our region and impose catastrophic burdens on our health systems, economies, and families. We note with concern that the current draft political declaration does not reflect the urgency of this reality. Proposed targets on tobacco, hypertension, and mental health fall far short of the scale of the crisis. Obesity, which is a modifiable risk factor, also remains critical to progress on NCDs. Stronger commitments on financing are needed, given that low ability from countries bear the overwhelming majority of NCD debts. Therefore, underscore the need to end silos, and efforts must be used to strengthen collective action to ensure no one is left behind. To ensure no one is left behind, we therefore call for the following, as I begin to end. 1. Dedicated global financing for NCDs, including catalytic funds, debt plus health swaps, and innovative blended finance, so that small economies are not left behind. 2. Equitable access to essential medicines and technologies for NCD prevention and care. 3. Recognition of the intersection between NCDs, climate change, and emergencies, as our small island states are on the front lines of both climate and health crises.
Thank you. Thank you, Your Excellency. Thank you. Thank you.
Thank you for these 2 minutes. For us, this is not just a political declaration. It is a
Thank you, Your Excellency. Thank you.
stands ready to act.
I now have the honor to invite